I grew up in Wangaratta, and then I took a gap year. I worked at Allura, which is North East Health's nursing home, and got a look into pharmacy there, did some student hours, started studying at La Trobe Bendigo, came back here for SHPA summer placement as well, and here I am now doing my internship. Did a lot of different student hours with La Trobe, did non-traditional placements, did Metro Hospital, regional hospitals, community pharmacies, and after everything I saw, this was the best. Yeah, they really have you out there doing things from day one, which I absolutely love. It's a fantastic way to learn, and for some people this is the best way for them to learn. So if that sounds like you, then this is definitely a great option.
So I think the reason why I decided to go rural for my internship is because I did a student summer placement at North East Health, and I decided that I wanted to be in this area because the people, the patients, and all of the allied health team as well were really friendly and really encouraged learning and just development as a whole. It was a really great place for students, for me as a student, and I decided that that's where I wanted to be. It was also a great opportunity to be closer to my family, but also just to be in a community that's smaller, a lot less pressure, you know everyone on your team. And yeah, it was just a nicer environment to sort of just build that confidence that I was really lacking at the beginning of my internship.
The program really stood out because it was well structured. So given there's rotations on all the different wards, and throughout the year your knowledge and skills are built up and worked upon, and it's a really supportive team that allows you to build up those skills, and from there be able to complete all the requirements for the internship program. It's been really important the way that I've been supported throughout planning my year for my intern year, especially that I have young children and have to organise them, especially during school holidays and things like that. We've been able to schedule my timetable to suit me to have some time off with my children during school holidays, which is really important to me because I like to maintain that balance of spending time with my children but also being committed to my intern program. I think the importance of being in regional and rural healthcare is the impact you can have on the communities here.
So my name is Stephanie. I'm the current intern preceptor at North East Health Wangaratta. I was interested in actually experiencing a lot of different clinical settings that I may not get to do in the metro setting. So you've got your specialties such as ICU, ED, oncology, mental health, amongst other general medicine wards and surgical wards, etc. So I thought that might be a really good opportunity to stick around, and the people also help. I actually really like the structure of the program. Each intern has a period of time in each of the wards, the general medicine ward especially, and the surgical ward, where they're working alongside pharmacists to manage a high turnover workload, which has its complexities, as well as look after their own wards such as maternity, dialysis and the day stay unit, which they have a little bit more autonomy while also checking with their pharmacists who are supervising them. They also have access to the specialty wards and have rotations throughout those areas too, which gives them a bit of a taste of what's to come when they graduate and they stay on as a pharmacist. There's a really good education program. We have our pharmacists conduct clinical tutorials, which are quite go over a lot of the clinical disease states that we would want our interns and our young pharmacists to know about, working in the different settings as I mentioned, as well as intern-focused OTC tutes, which help cover the community side of stuff, which would actually be in your exam setting as well.
I definitely say, first thing, if you're considering it, come and have a chat. Come chat to someone who works in a rural pharmacy. Definitely tour a place if you want to. We're always open for tours, I know that. Have a look around, see if that's something you're interested in doing. But honestly, I just say do it.
Hi, I'm David Ford. I'm the Director of Pharmacy here at North East Health in Wangaratta. If you're a undergraduate student considering a rural placement or wanting to do your internship in the country, please consider coming up to North East Health in Wangaratta and Benalla Health. We have a fantastic program up here. It is a very structured, very clear program for our interns. We provide you a patient load very early on in your internship to give you some responsibility and teach you various skills that you'll need as a pharmacist. And also our education program, which is very, very structured, both from a clinical perspective and an over-the-counter perspective. Please come and talk to our current interns or our past interns about their experience up here. But if you're considering a rural placement, I urge you to consider coming up to Wangaratta and Benalla. It'll be the best decision you ever made.